Bismillahirrahmanirrahim. Assalamu alaikum. It is the end of our 23rd National Health Science Research Symposium at the Aga Khan University. We are all meeting now for our concluding session. And first, I would like to invite Dr. and Professor Rozina Karmaliani, Dean, School of Nursing and Midwifery, Aga Khan University. Dr. Rozina will give welcome remarks. Dr. Rozina.
Bismillahirrahmanirrahim. Good day to all of you. Welcome to this 23rd National Health Sciences Research Symposium. This is a very different kind of a welcome. Usually when we are here and when we give the address and Dean Adil is here, we give this kind of task, giving the welcome. Then welcome means there are people you are welcoming and bringing them to the auditorium. But this welcome is welcome where I have 5 people sitting here with SOPs, but the rest of you are welcome to your own spaces in your own digital platform and with your own gadgets. So enjoy this concluding session where we have brought you fantastic summaries. And those of you who were busy in your clinical work or educational work and were thinking, oh gosh, I've missed Naima, or I've missed the clinical practice session, or I don't know what Faisal talked about vaccines and whether I should get it or not. So then all of this is in the summary here. So stay tuned and don't go away for the next 2 hours, because we are going to bring from the public health, which Dr. Laila Ladak is going to give us a good summary, to the virology, clinical practice, and vaccines. So we have great speakers who have worked hard to bring the summary from different sessions. There were parallel sessions, and when I was coming here, there were people who were saying, oh, this session was also good, but sorry, I was in that session and it was parallel, so I couldn't attend. And that's always a sign of a success. So Dr. Asad and Dr. Rafat and Dr. Faisal are chairs of the organizing committee. This is a success sign when people say that I wanted to attend 3 parallel sessions together, but oh gosh, I missed this. And therefore, we will have the Facebook, we will have YouTubes, we will have the links running. So you can choose your own favorite speaker, you can choose your own favorite session, and you can listen in your own time. And as I was discussing with Dr. Faisal, that usually clinicians and academic administrators, we don't get time, meetings after meetings or patients after patient. It always helps when you tell your students, we are going to watch this. This is very important for you. So they see it and you are by force, no choice, see it if you are the leaders or the clinicians. So make it happen for your residents, make it happen for your students, and in that way you will really going to enjoy. We will be having a way forward, because way forward is very important. What's next? 2 days fantastic learning, but then what's next? So my partner here, Dean Adil, is going to talk about a way forward, which is going to be collaborative research and also work which nurses and doctors and allied health as a health sciences have done it. So this is a beautiful example of first ever full virtual symposium where thousands of people have tuned in and then thousands of people have commented, and again, many more will be able to listen. So this 23rd National Health Science Research Symposium, the last 2 days was learn and save life. So I would say that whatever learning you had, the message is that we have to all together save life. One more thing I'll say before I take my place and then give space to people who are going to give the summaries. We are having a good keynote, inspirational talk from Dr. Julie, and also our president, Feroz Rasool, and our provost would be joining us at some point, or maybe have already joined us. So welcome to all the participants, all the speakers, all the audience. And before I take my seat, I'm going to talk about one-liner way forward. And Dean Adil, excuse me if you have already, this point you can, with your smartness, you can bring 3 other points, I'm sure. And that is vaccine hesitancy. So from a public health perspective, I think as the educational and science have moved on, rollout of vaccine to everyone with the vaccine hesitancy, we will have to think of strategies where we bring nurses, midwives, allied health for community engagement within the community setup, and therefore public-private partnership, which we already have and we are enjoying so beautifully in our inauguration session. We saw the public sector commitment. We also saw the leadership commitment from the government level. And we know that the technical advising is from AKU, mashallah. So with all of that, if we can have the rollout science, and if we can have the acceptability and hesitancy strategies worked out in a way that together as a community we save ourselves, but at the same time, the fear are also genuine because it's been the clinical trial have been for a very short time, and there's a lot more science which we are going to learn through the research about the side effects, about the contextual differences, about the gender differences, chemical differences, are men and women react and differently. So all of this science will continue, and Dr. Faisal and many other clinicians and infectious disease people from the WHO to CDC to AKU and around the globe are working towards that science and knowledge development. So together, I'm going to give you this mission that continue learning, stay updated, and when you learn, make a mission to save lives. Thank you and welcome. Enjoy the session. Allah Hafiz.
Thank you so much, Professor Rozina Karmaliani. To all of you, let me tell you that we are very lucky that this is the year of nurses and midwife, and WHO, IC and ICM has announced 100 women powerful, and 8 were selected from Pakistan, and they are all from Aga Khan University School of Nursing and Hospital, and Dean Karmaliani is one of them. So thank you so much. Now, it's a time of summary. And for those who were not able to attend, you must attend summary session. At the end of the day, breaking news tell us everything. So here is the summary session. And I would invite our guru of infection control, who is also known as Dr. Corona. That doesn't mean he is spreading Corona. In fact, he taught us all the time. He's working very, very hard how not to spread Corona. So Dr. Faisal Mahmood will give summary on clinical care.
There you go, I turned it on. So thank you so much. And thank you, Rozina. I just want to say that 1.5 days ago or 2 days ago, I was here after I got my vaccine, and I'm still here. So please go get your vaccine. We're all okay. So I'm going to do a quick update on what happened in the last 2 days on clinical care at the NHRS. And I must also echo that I love the online format. I got so many things done while in the conference. Otherwise, you'd usually tied in one place for this. Just an overview of the clinical care. There was one whole stream of the conference dedicated for this, almost 10 hours of sessions actually in all. We had speakers ranging from ID specialists to critical care specialists to hematologists, radiation oncologists, all talking about different aspects of management of COVID-19. If you look at the sessions that we had, there was one session just looking at targeting SARS-CoV-2, looking at the different drugs that are available, also ICU management and how to manage these really difficult, challenging patients. There was managing the complications of COVID-19, which obviously is a big issue, from thrombosis to aspergillosis to long COVID and then reinfections. And then finally, the immune system and how to modulate these, both in terms of using therapy and also radiation therapy. So instead of going over all of these in great detail, because that would just, then I would be, one whole conference would just be, again, me. What we're going to do is I will just go over all of the concluding slides from each of these presentations and just talk about what they mentioned. So Dr. Sunil actually talked a lot about the controversy around remdesivir because of the conflicting statements. He mentioned favipiravir, which actually should be available here soon, and obviously ivermectin, which according to him is the new hot topic in COVID-19. But he re-emphasized the time frame of COVID-19 and the 3 stages of COVID-19 and how each management and each stage the management needs to vary. And this was a recurring theme in all of the talks. Dr. Salma gave a very nice summary of all the different options that are available for COVID-19 treatment. She had a wonderful table, which I put over here, which goes over the different therapies, what the data is about them, and when we can use them. She also mentioned about the new variants, the pandemics, and the fact that we don't have a lot of detail on the pregnant women, children, immunocompromised hosts, and that is obviously all upcoming. We had Mehreen Arshad from Northwestern who talked about a different aspect of COVID-19 management, which is antimicrobial resistance, and how antimicrobial resistance burden is probably increasing because of COVID-19, and especially in the low and middle income countries, because these are countries which don't have regulated antibiotic access, and also there, because of the health disparities, there may be much more antimicrobial resistance that we may see because of COVID-19. And then obviously went over the fact that antibiotics are generally not indicated in this particular infection. And then finally, Dr. Masuma, who's a critical care physician, went over the principles of managing ARDS in these patients, and went over in great detail the 5 or 6 things that we need to do, such as using low tidal volumes, tailoring the PEEP based on the bedside assessments, all the data about proning, which has really helped, steroids, obviously, which is something that came up over and over again, and then fluid management associated with this. In the second stream, we had managing complications of COVID-19. And over here, we had Dr. Muniba speaking about a really contentious issue, which is thrombosis. She went over a lot of the trials regarding both inpatient and outpatient thrombosis, and also went over the fact that a lot of the guidelines don't really recommend using a lot of anticoagulation, which is somehow become very fashionable currently in GP practice. COVID patients do not require, that don't require hospitalization, really should not be on any anticoagulation. And also use of D-dimers to decide on anticoagulation is also no longer warranted, something which has changed since June when we in the first wave. We had David Denning from the UK talk about invasive aspergillosis and in COVID, also called CAPA or COVID-associated pulmonary aspergillosis, and very nicely described the various features of aspergillosis in general, and then the emerging evidence of CAPA, and then finally the lack of consensus that was there in diagnosing this really difficult infection to diagnose, and the diagnostic criteria that have now evolved based on consensus statements. He went over the treatment and provided a very nice algorithm for CAPA. So when these lectures are online, I would encourage you to have a look at this, which really I thought was excellent. We had Dr. Kiran talk about long COVID, which is really becoming a bane of our life. So you know, when during the COVID peaks, we see a lot of acute COVID, but during the troughs of COVID, my clinic is full of long COVID. She went over how the data is emerging and how we're not sure why people get this sort of long symptoms of COVID, which can go on for months, actually, with fatigue and breathlessness and chest pain. And then the risk factors, obviously, which is over 50, those with comorbids, those with had more severe disease, and then went over some of the guidance on how to manage each of the symptoms of long COVID, starting from fatigue and mental fog to shortness of breath to the cough. And then finally, we had Dr. Samreen talking about the other hot thing, which is reinfection and COVID. And she went over the differences between reinfection and relapse, and what timeframes we're looking at, and how this has evolved from the very first case we saw from Hong Kong to the 3 cases that were reported in the press in Pakistan, including the last one who passed away, and how the fact that even if you have antibodies after a COVID infection, it does not prevent you from getting a reinfection, and why this may be so, especially with the new variants coming in, and some fantastic slides showing the different variants and how the spike has changed with each of these new mutations. And then finally, the last stream was talking about the modulating the immune system, which is what we see in the third stage of COVID. And Dr. Farheen spoke about convalescent plasma, how it's evolved from the historic SARS-1 and then MERS, and now for COVID, and how the initial data really did not show much benefit, but maybe in early disease, it may show more benefit. She also talked about some of the monoclonal antibodies and how more data is required, but however, in our population, fortunately, cost may be an issue. Dr. Adil Butt spoke about all the different types of immunomodulatory therapies that are involved. And this very nice summary slide, which goes over the 4 big ones, which is DEXA, tocilizumab, and the 2 monoclonal antibodies, and how even amongst the monoclonal antibodies, there is a difference of when you would use one and when you would not use the other. And how, unfortunately, not over here, but in the more developed countries, there are more options now to treat these much more difficult patients. We had Dr. Khurram talk about radiotherapy and COVID, which was actually well received and a surprise to a lot of people, how the initial phase 1 and phase 2 trials are showing that maybe low dose radiation therapy may actually be beneficial in curbing some of the immune issues. And the phase 3 trial that we are actually also trying to start over here in looking at severe COVID and how we can use radiotherapy to sort of, again, diffuse the immune system a little bit. And then finally, Dr. Natasha spoke really nicely about convalescent plasma and gave details about the trials that we had over here, the trials and tribulations, I must say, talking about all the issues she had with getting the plasma and how patients responded, and how, and also presented her own data from this trial. And again, re-emphasize the fact that in very sick patients, this may be utilized along with plasmapheresis. And this was sort of a brief summary, but not all that there was in the clinical guidelines. But I do want to point out one thing before I move on, that a number of the ID speakers in this conference were our own local national speakers, and really a product of the training that we have started in ID in Pakistan. And really, you don't see them here, but this is a testament to the ID giants like Dr. Naseem Salahuddin, Dr. Bushra, Dr. Shalabaki, Dr. Faisal Tan, who really, and this is their pedavar, so to speak. After, we also had 2 really good free papers, one by a medical student looking at tocilizumab and a meta-analysis showing that did help improve oxygenation. This came really at a time when recovery trial has just shown that tocilizumab may actually be of benefit, and this was just published last week. And then the neurotropic effects of COVID-19, which was something that came up again in Meet the Professor session that really started off the conference. These don't give, these slides don't give, you know, can't really capture the conversations that happened after the sessions with a lot of the question answers that happened, which were very, very insightful. And we got to hear directly from the speakers during these. And right in the end, what ended up with a session going over each of the management, and Dr. Ramla, which you see in the middle, are year 2, well, year 1.5 or 1 fellow. And also Dr. Sidra, who is our PEDS resident, actually described 2 or 3 cases of COVID-19. And the adult one really took the journey of a COVID patient, starting from when the patient had symptoms to the diagnosis, to the admission, and then finally the discharge, and each of the aspects of both treatment in the outpatients, in the inpatient, and also not just the management, but also we had our nurses, both infection control and on the floor talk about issues that they see in real life with social support and proning, etc. We had Dr. Amber from critical care, and then obviously the peds talked about MISC, and what I found great was the cross pollination. We had the critical care doctor talking to the lab people, getting answers about CT values. We had the adult ID physicians speaking to the peds, talking about how different COVID presents in adults and in children. And we had infection control talk about how we can use the molecular lab. And this sort of cross-pollination, people who would never really talk otherwise, was a great thing to see. And then finally, my last slide is that the conversation continues on our ID forum. This is something Dr. Faisal also mentioned. And this is the group that as ID physicians have. And there's a lot of buzz, which is still ongoing about how people want to listen to the talk and how things were great. And our conversation and our management will continue. And that's it. Thank you very much.
Thank you so much, Dr. Faisal Mahmood. Our next speaker is Dr. Syed Hani Abidi. Dr. Hani, I found throughout our group work, he was very, very quiet and very persistent in his work. He will be giving us summary on virology and diagnostic. Dr. Hani.
Thank you so much, Dr. Rafat. And I think we managed to deliver our task. So that was one of the achievements of the entire group. And I couldn't thank all the people enough who were actually behind making this event successful. I really loved the platform, loved visiting again and again. So it was so smooth, and it's also evident from the number of chats we received. So what I did is what I was asked to do is to summarize virology and diagnostics together, two very important, and one is actually has a threshold of the basic sciences towards it. So I thought to make it more of a systemic slide, talking about the virus and putting in the ideas together from the speakers that actually talked about went to different topics yesterday. So what we learned is that this virus has been was responsible for 107 million cases so far and approximately 2.3 million deaths. It's a beta coronavirus family, approximately 29.9 kb genome, and which is RNA in nature. So basically a great weapon to mutate a lot. And it enters the cell through various receptors. ACE2, TREMPES, and furin are the supporting receptors. And because of that, the virus is able to infect a wide variety of cells, neurological cells, lung cells, kidney cells. So wherever the ACE distribution and TREMPES and furin is there, the virus is there. So this is important. And I think this was a buzzword from the yesterday's work, is that the substitution rate is 5.35 into 10 to the power 3. So simplify it down, a very high substitution rate. So viruses who have been around for years couldn't achieve this substitution rate, which coronavirus already has achieved. So we encounter a lot of evolution. We expect a lot of evolution, a lot of changes that's going to happen in the future. So starting off with Professor Aga Khan's talk, and really taking the threshold towards the diagnostics, which is the serology. So she presented out about two different things. One is rapid diagnostics, and one is basically the quantitative ELISA or the antibody titers. So both have their merits, both have their the downfalls. The merits are for the rapid test is faster, which facilitate large screening, community screening, and so forth. But your ELISA test is, or the antibody quantitative measurements are more sensitive, they are more specific, and also they have the potential to differentiate between the acute and the convalescent phases. So basically substituting a lot of your those points where PCRs are essentially missed. So couldn't emphasize enough that both of them do not have the capacity to talk about the immune status of the patient as of now. So it has to be of diagnostic value. The second thing is that was Dr. Zara Hassan actually talked in detail about the molecular testings, different evolving platforms that we have. And the crux of the talk is that you start off with the nasal swabs, the oral swabs, taking the samples, doing either the RNA extraction and going towards the DNA, or direct one-step PCR, which is more of an automated procedure, and ending up in real-time quantifications, right? So this slide at the bottom, actually, I borrowed from this Nature Communication papers. This summarized very nicely different viral titers from different samples. So be it the fecal sample, stool sample, the bronchoalveolar sample, the virus titers varies a lot. And if you see from week 1 to week 6, the PCR has the tendency to pick out almost very efficiently in first 3 weeks. And after that, the titer declines. It's very difficult to actually pick out the virus on PCR. However, antibody reliance comes in, and actually from week 2 to always all the way to week 6, you are actually very well can pick out whether the patient has converted, seroconversion is there, and whether it's in the acute phase or the convalescent phase. So these are few of the recommendations from the Dr. Zahra Hassan slide, that the PCR assays, wherever new laboratories are trying to do it or someone is trying to validate it, there should be a robust validation of the PCR assay. It's very, very important. I think I couldn't emphasize enough to set up a negative cutoff value. Why? Because it will differentiate between the negative samples and those samples which are very close to the negative titer or very low end titer. And those are which we like to call borderline positive, those samples which are very near to the cutoff values. And this is an important point. So PCR doesn't have to be qualitative anymore. We can use the CT values to classify them as high titer values or medium titer samples or low titer samples based on what CT values we're looking at. It would give kind of an estimate of what is the viral threshold in the patient and whether the response is there, what is the condition, and you can maybe tie off to a lot of things together. I cannot ignore to mention the innovation of printing 3D swabs for our own use, actually, and that's one of the free papers that Dr. Zahra Hassan actually talked about. Right, so then I actually took over. I actually talked about several variants in evolution, and the viral variants which just aid and next strain, which are the two giant hubs in the analysis of coronavirus. Actually, they have divided them into 7 clades, 1 and 5 clades together. So some of the notable variants you are actually seeing in the media is the UK variant of concern 2020-1201, or the South African variant, or the Nigerian variant, or the Danish variant, right? So these are cluster 5 variants. So this is just the beginning. So considering going back to the substitution rate, you'll see a lot of hundreds and hundreds of variants coming up, right? So, and the ability or the capacity to pick out these variants all relies on the sequencing platforms that we have. And here, Dr. Asghar Nasir's talk came in. Asghar talked about in great detail about different platforms we have, the Minisec, the MySec, the NetSec, the NovaSec, generating huge amount of data, covering a lot about different kinds of samples that we have. And also you see at the bottom, the Oxford Nanopod that we also have now, one in AKU, where we actually can do a very small instrument, but generate potential data. All of it actually, whatever the sequence platform is, but the sample, it all lies into 4 steps of the sequencing platform. So you always start off with separate sample preparation, that is getting out the RNA from the samples, then library preparation, they're followed by sequencing, and a very robust and thorough data analysis pipeline that we have to follow. All the people who are watching it out, it's very important. Anyone planning to do sequencing before the library prep, Arctic protocol now kicks in. Arctic people are actually, they're experts in the field. They've talked about the value of doing PCR, the whole genome PCR during validated PCR primers they have developed before going for the library prep. And because of that, the sequence quality actually has drastically improved just by using PCR rather than direct library prep. Okay. So Dr. Asghar's talk summarized to 3 points that the genomes of the SARS-CoV-2, these technologies, they have allowed these genomes to be sequenced, even in the matter of hours to days, actually. And genomic sequencing in real time or near real time has been able to inform the public health response to the pandemic. And obviously, with sequencing, large-scale genomic epidemiological studies are possible, contributing not only to the infection dynamics, but also to the transmission dynamics of the virus within things. So for example, one question is whether the UK variant is here in Pakistan, whether South African variant is here in Pakistan. You cannot simply tell it using a real-time PCR. You have to go for sequencing. And for these, all the platforms are over here. So I also talked about the comparison. So there's a phenomena that some nations are doing better than others. So that's one of our studies, a basic science hypothetical driven study. We're looking at that the hypothesis had that the pre-exposure to the endemic coronaviruses can actually confer protection against the SARS-CoV-2. And we came to know that the SARS-CoV-2 is not the first human coronavirus. It's the 7th one. And if you see, most of them have actually evolving in bats actually. So there might be potential to get more and more coronaviruses in the future. So, so here, Dr. Brian Foley from Los Alamos and myself, we talked about genomic similarity, not even between only coronaviruses and the endemic MERS-CoV and SARS-CoV-2, but also between SARS-CoV and HIV. And on the left, you see that the CD4 binding region of HIV, that's the receptor equivalent to the spike of the SARS-CoV-2. You see the diversity in HIV is huge. And in ACE2 of SARS-CoV-2, the diversity is very limited, which is actually good news for people who are actually developing vaccines, because it means that anything that can go for serve as an entry point inhibitor or as a vaccine, there won't be much of escape at this point of time. But the virus with this substitution rate might add up something on the left that HIV is exhibiting, and that's why we don't have a HIV vaccine today. So the similarity shown in the top ranges from 43 to 58%, which put me to this slide actually, that it's not just the antibody response that is conferring the protection. So if you look at the graphs, the purple one, which is the viral titer, versus the red one, which is the T cell titer and the B cell titer, you're going to look at that the viral titers, the T and B cell titers, goes hands in hand with the viral one. So viral load goes up, the T cell response goes up, and with the decline in the T cell response, the viral titer also go up. So which put forward the hypothesis that it's not just the antibody response, but also the T cell and the B cell responses which confer protection. Which takes to my summary slides, which is that the SARS-CoV-2 share 40 to 90% epitope sequence similarity with other coronaviruses, especially those which are endemic to human coronaviruses. And kind of supporting the hypothesis that prior exposure to any of the endemic coronaviruses may confer temporary cross protection against severe SARS-CoV-2 infections. And the protection is not just mediated by antibodies, but also by B and T cells, and providing a proof of possibility that there are several biological and epidemiological mechanisms that could potentially serve against COVID-19 protection. Right, so concluding on two very great nice talks, one a free paper by Dr. Kulsum Mehdi, and again a giant in the field, Dr. William Petrie, talking about the biomarkers and their relevance. So Dr. Kulsum talked about the neutrophil to lymphocyte ratio, which has a role, which is kind of serve as an indicator for disease severity and eventually ARDS, acute respiratory distress syndrome. And she suggested that the serial measurement of neutrophil to lymphocyte ratio can predict whether the person will develop the ARDS or not. Professor William Petrie presented amazing data on humans and mice, talking about IL-13 as a marker for disease severity. He showed RNA sequencing, the transcriptomic studies showing that hyaluronan, which is a downstream target of IL-13, is also raised in patients with disease severity. So, and they also showed that neutralization of IL-13 confers protection against SARS-CoV disease protection. And they also tested out the dupilumab, which is an monoclonal antibody, which is a joint blocker of IL-4 and IL-13. By doing that, it actually does not lead to disease exacerbation. So basically, what the point of this talk is that IL-13, hyaluronan were both related to long COVID. So to summarize all of it together, they are very powerful sequencing platforms, diagnostic laboratory assays, which should inform both the epidemiological studies and also how the patient is managed. And also these biomarkers can actually talk a bit about whether they can serve as an indicator how well the patient would do or not. And obviously, if you want to do a systemic investigation of immune responses, you cannot simply choose to ignore the T cells and the B cells. You have to look at that. And the second thing you need to do is basically is focus on that the pre-exposure with different endemic coronavirus exist or not. So with this, I am going to thank you for your attention. I'm going to thank to all the speakers who presented this amazing data. And I really hope we'll carry it forward, this studies, and actually build upon increasing our knowledge on the coronavirus biology. Thank you so much for that.
Thank you so much, Dr. Hani. Amazing science, which we are learning in the diagnostic. And our next speaker is Dr. Laila Ladak, who is sharing job between PEDS and School of Nursing and Midwifery. And she will be presenting summary on public health.
institutional leadership speakers, conference organizers, and my colleagues, Assalamu alaikum and a very good evening. First of all, I would like to congratulate the conference organizers, and I am one of them. So congratulations to all of us on successful completion of this hybrid model virtual conference, 23rd National Health Sciences Research Symposium. And I think the theme that has been chosen, focusing on COVID-19 challenges and way forward, I think it's a great theme. And I think as all the speakers and as organizers, we have tried our best to do justice with the theme. So moving forward, in the last 2.5 days or so various aspects were covered in breadth and length from COVID's perspective, from public health aspect. And as we are aware that public health is a cross-cutting edge. So the topics or the themes related to public health, they were integrated into different topics and titles dealt by different speakers. However, there were few sessions and few speakers who specifically talked and focused on the public health aspect of COVID-19. And there was overwhelming response from the participants, which was evidenced by the number of participants who joined virtually, as well as the chats and the questions and the comments that we received. So we had our institutionals, national and provincial leadership who were part, and this is the slide that you are seeing is of the launch ceremony, which was done on the first day. So these leadership, they highlighted the significance of public health in pandemic, as well as the need of preparedness for just not for this current COVID pandemic, but also for the upcoming any such pandemic or any other health issues that we may encounter in future. So we had speakers from across the globe, and they were from WHO, NIH, ICN, and so many other renowned institutions and organizations. And this is like just a glimpse of speakers who focus mostly on public health. So I'm just going to give you a summary or an overview of the discussions that were dealt and conducted by the different speakers from across different parts of the world. So the initial response to COVID was discussed, and as we are aware that COVID-19 pandemic was something very new to everyone, and nobody was prepared for it, not just the LMIC, but the high income countries also, where they had a very good or strong infrastructure. They were also not prepared for that. So initially everybody was struggling with, because there was no clarity in terms of the guidelines, both for screening, for management, for prevention, etc. And the struggle in terms of the resources. So by resources, I mean the financial resources, the material resources, the manpower, the expertise. Everybody was struggling and going through this phase. We all understand that this COVID pandemic started from China, and it later on spread to different parts of the world. So the struggle was more or less the same across all parts of the world. So there was a dilemma of life versus livelihood, and especially people or communities or countries with resource constraints, or particularly the low middle income countries. This was a dilemma because should we go for lockdown, or should we not go for it? If we go for lockdown, should it be just a lockdown, a smart lockdown? What should be open? What should not be? What should be the timings? How many people should be allowed to attend maybe schooling, for example, or any ceremony or any event? So those were some of the hardcore decisions. And in the launch ceremony, our national and provincial leadership, they very well and they dealt this thing in detail, that what were some of the initial challenges and how they managed those challenges. So with regards to lockdown, from the public health perspective, there were a lot of issues in terms of the mental health, the inter-partner violence, gender-based violence, food insecurity, education. Because as a university, if you look at, and there were a lot of other universities by which they were not ready to go for a hybrid model for education, they had to. And in a country like Pakistan or any other LMICs, where the infrastructure in terms of the internet connectivity, etc., was not that strong. So how did we manage all those things? So these were some of the aspects that were dealt. In terms of the guidelines and SOPs, so there were discussions around social determinants of health and COVID-19. And studies have reported that the non-pharmaceutical or what we call as behavioral change, and it has a huge impact, and research has and studies have reported, and it has proved that how these behavioral change, though they are low cost, but has a huge impact in terms of prevention and decreasing the numbers and the trends of COVID-19. So how do we implement? Because a lot of the LMICs, in terms of social determinants, the literacy is an issue, and the finance is an issue. And there are so many, accessibility is an issue. So how do we address all those things? And what were some of the challenges, not in terms of just the LMIC, but also from the high income countries' perspectives? And the speakers dealt them in quite detail. In addition to that, so from the government's perspective or national policy perspective, so when we talk about the SOPs and the guidelines, so for example, social distancing is and hand washing and all the SOPs and the guidelines, which we have become so fed up of listening to every day. And sometimes we also become desensitized that every day we are listening to the same thing, that you have to do hand washing and then social distancing. Sometimes you listen it's 3 feet, sometimes it's 6 feet. So SOPs and the guidelines, they are evolving, and of course they're evolving based on the evidence and the studies and the research and the literature that has been published. So it becomes difficult to keep ourselves abreast of what is the current guidelines, and similarly making the community aware of, and from the public health perspective, how do we make sure that the people are following those things? So for example, the social distancing, like a lot of people here in LMIC, like Pakistan, so the family size is relatively larger compared to what the space of the household they share. So it becomes very difficult to educate people and to create awareness that the social distancing is important, but then operationally, how they do that? So the provincial and the national government, they successfully created and developed this community-based and the screening centers, and then the field hospitals, and then quarantine centers or high dependency units. And that was done in quite short notice or a short period of time. So all those were the responses from both national level as well as the provincial level. In terms of the scientific community's response, as I already mentioned, that a lot of the guidelines and the SOPs that have evolved and are still evolving. So they are based on the research that has been conducted by a lot of clinicians, nurses, allied healthcare professions, scientists. So basically a multidisciplinary team approach. And we do have literature published from this part of the world as well. And this is going to help us in developing and formulating our policies and practices. Regarding the healthcare providers' response, so a lot of stigma and fear has been reported, and this is not from one part of the world. These issues and these challenges have been reported across the globe. The severity or the magnitude may vary from continent to continent or region to region, but conceptually it was there. And there were healthcare providers who lost their lives while taking care of COVID patients, while taking care of near and dear ones. And I personally feel that this conference I think we need to acknowledge and honor all those healthcare providers who lost their lives in COVID-19. And because of them, a lot of people who are with us, they are alive. So I think we need to acknowledge and honor all those healthcare providers. Other than that, the vaccine, in terms of the trials, the vaccine trials that have been conducted and still are in progress. So Dr. Faisal has very well shared the details about vaccine trials, and then about the vaccination and some of the reservations and the questions and queries. So I'm not going to go into those details. So at the government level, from the public health perspective, planning regarding the procurement, storage, administration, and all those things, the planning is still under discussion. And in fact, the vaccination has started, and it will be expanded to the community level in a very short period of time. In terms of innovation and technology, so low-cost equipments, and Dr. Hani mentioned about the 3D nasal swabs and low-cost equipments like the ventilators, the low-cost ventilators that have been created, developed, and a lot of diagnostic and predictive modeling, use artificial intelligence. The Sehat app is one other example, and there are so many other apps where community people from the public health perspective, they can screen themselves. And based on that, if at least the first line screening is done, and then whatever the interventions that need to be taken, so we can use, so these are low cost and cost effective strategies. So having said that, there are a lot of challenges and issues that were discussed in multiple sessions by different speakers. There's an opportunity that we can see from COVID-19 pandemic. So it gave us an opportunities, and this symposium is one live example. So people from different parts of the world across the globe, we are all together, even if it's virtually, but virtually we are connected, and the geographical boundaries where we always used to, discuss. And a lot of the things that we were discussing in the pre-COVID era, say, for example, teleclinics, telemedicine, and we were always thinking that resources are an issue, and these could be, and then there were our personal reservations or maybe a system reservations. And I think COVID by force, it actually provided us an opportunity, especially when we are talking about the public health. So for example, a lot of the patients, and especially I'm talking about Pakistan, where 70% of our population, they are residing in rural areas, where the accessibility, availability, affordability, everything is an issue, and quality is again an issue. So a lot of the healthcare organizations, they have come up with the innovative ideas and solutions so that these barriers could be mitigated. And when we talk about quality of care and to improve the quality of life, so I think COVID has provided us an opportunity. And virtually, as we are connected, and we have been connecting in the last whole year, and I think this new normal is going to be more or less the same, or maybe we may come up with some more innovative ideas, who knows, that in addition to Zoom and so many other things, we can come up with some other ideas. So I think COVID has provided us an opportunity. In addition, I also see this, that health in some of the low middle income countries, where people had to pay from the pocket because the universal health coverage is not an option, unfortunately. But this COVID pandemic, it may open doors for such type of discussions and such type of benefits to the community, to the public in different countries, particularly low resource care settings. So I would like to end my presentation or the summary with this share of our great poet Iqbal, Allama Iqbal. एक ही सिफ में खड़े हो गए महमूद और अयाज, ना कोई बंदा रहा ना कोई बंदा नवाज. So with this, I think the issues and challenges which in the pre-COVID era, we were always talking about, okay, these are not the issues of high-income countries. These are low-middle-income country issues. And therefore, we have to come up with some solutions. And, but high-income country people, they won't understand. So now is the time that everybody is going through the same issues and challenges, and the destination is the same. So I think we are working collectively as one team, focusing and are, like pooling our energies, our efforts, our expertise, virtually or whatever medium it may be, towards the betterment of, humanity as one humanity. And then, COVID, I think I see it as a positive, opportunity for all of us. Thank you.
Well said, Laila. As our culture is foodie, so someone sent me burger or band kebab ek ho gaye COVID mein. So our next speaker is going to talk on vaccine, and she is a very much dear member of our committee. Always, if we divert, she brings us again on the driving in the right direction. Dr. Fyezah Jehan from PEDS, and she'll be giving summary on vaccines. Dr. Fyezah.
Thank you so much, Dr. Rafat, the audience who are present in the auditorium, as well as the ones who are watching. So I'm Fyezah Jehan. I'm a pediatric infectious diseases, and I'm sort of Dr. Faisal Mahmood's counterpart for pediatric infectious diseases, just like he leads the adult ID section here at Aga Khan University Hospital. A personal reflection before I begin. Never before has a disease or an illness stoked such an interest and so much information in such a short period of time that you can dedicate an entire conference to this illness or to this disease. And COVID-19 is truly a global pandemic, and it has affected our lives, like Laila mentioned, in ways which we had never imagined, and has been an opportunity for innovation and for improving systems and thinking about redesigning, re-engineering our systems. But when we talk about vaccines, vaccine is a very old intervention. It is one of the few successful public health initiatives. It would be the second one after safe water and sanitation. And therefore, when COVID struck, it was natural. Sorry about the mask. I'll just take it off. So when COVID struck, it was natural that one would think of ways of prevention, and vaccination would be one of the ways of preventing COVID-19. So I was moderating this 3-hour panel where we were going to talk about vaccines, where do we stand, and where do we go from here. We had 3 speakers in this panel, Dr. Tahaniat Lalani, Ms. Mariam Mansoor, and Major General Professor Amir Ikram. Dr. Tahaniat and Mariam Mansoor were our international speakers. One was from an academic institution. Mariam Mansoor was from Village Reach, which is an NGO, and we are all familiar with Major General Professor Amir Ikram, who heads the National Institute of Health in Islamabad. And we were joined as panelists, along with the speakers, by Dr. Faisal Mahmood. And we had about 100 people who were watching the session at that time, which I thought was remarkable for a 9 a.m. Saturday morning. So I'm going to give you a sort of brief of what was discussed and maybe add a bit of my own reflections in this. So I apologize in advance to all the presenters, because I took something from their slides and I added some of my own. So we discussed about the options of COVID-19 vaccines, and it's remarkable that in just a period of over a year, it's been almost a year since the pandemic was announced, we have had almost 200 vaccines that have been in various stages of development, either animal testing or lab or clinical stages, with almost more than a quarter of them that are already in a human clinical trials phase. And we have several vaccine candidates that have already been rolled out. In fact, it has been about 56 days since the first vaccine candidate was rolled out. When we talk about COVID-19 vaccines in Pakistan, currently we are, the Drug Regulatory Authority of Pakistan has approved 3 candidates, and we just heard, I think yesterday, that one more candidate, CanSino, has also received emergency use authorization. So we discussed and compared the different vaccine candidates that are available. So for instance, the Sinopharm, which uses an age-old technology, it's an inactivated viral vaccine. The age of eligibility is 18 to 60 years. It's a 2-dose vaccine with a 21-day gap. And it is currently being rolled out in many countries, including Pakistan. So we began the Pakistan COVID-19 vaccine drive in the middle of last week, and this drive is ongoing, and I'm going to give you some updates about that as well. The DRAP has also given emergency use authorization to the Sputnik 5 vaccine, which is a viral vector vaccine. This is also a technology which is relatively known to us, as is AstraZeneca, which is also a viral vector vaccine, but for which the viral vector is the adenovirus vaccine. The common thing about all of these vaccines, which have been approved for Pakistan, is that they do not require very stringent cold chain maintenance. So obviously cold chain is required, but fridge temperature is what is needed for these vaccines to be efficacious. In terms of efficacy, it seems that these vaccines may have different efficacies for overall control of the disease, But when we talk about severe illness, most of these vaccines have very good efficacy from 90 to 100% in prevention of severe disease. We also spoke about, so this was actually Mariam, who spoke about the COVAX support. So as many of you know, that COVAX is it's a public-private international NGO, many governments partnership, and Gavi Alliance is a part of the COVAX. And what the purpose of COVAX is to provide vaccines, these COVID-19 vaccines, to countries that cannot afford these vaccines and make them available over a short period of time based on the requirements of the country. So the COVAX support is not limited to just provision of vaccines, but it is also providing technical assistance, for instance, for vaccine management, for vaccine procurement, for cold chain maintenance, and for also, if helping the governments to create their deployment plans, what we call as national deployment and vaccination plans. So AMC actually means advanced market commitment, and COVAX works with AMC, the principle of advanced market commitment, where they say we will make the vaccines available for a large number of people, and they sort of broker the deal between governments and with vaccine manufacturers to ensure that vaccine manufacturers can create a large number of doses to be provided in a short period of time, and simultaneously ensuring that the pharmaceutical companies can continue creating the vaccines. And so they kind of take care of, they bring the demand side and the supply side together to enable these things to happen. So there was a lot of detailed discussion in our session around how COVAX is facilitating this entire process. We also spoke about challenges regarding the COVID vaccine rollout. So there was a discussion around how the focus has been on creation of these vaccines and ensuring that you have the right number of doses. So what we call as AKA, we call as procurement. But very little focus has been on actually, the distribution of the vaccines. So when we were discussing Pakistan in particular, Mariam spoke about optimizing the point of entry. For instance, if the vaccine is going to arrive in one city, how efficient is it for the vaccine to be distributed from one point of entry to the entire country? And when we say country, we are thinking of provinces, districts, vaccinating centers. So there's a whole, transport logistics which is involved, which has been very challenging for countries, including Pakistan. We also discussed supply chain for efficient distribution, which is kind of related to this transport, and assessing, managing, monitoring storage. So Pakistan has been lucky in the sense that we have a very well-established expanded program of immunization. So there's a lot of learning where the sort of developed world can learn from the developing countries because they have experience of deploying these large immunization programs in their countries, which are facilitated through the government. And in this way, in this regards, we are sort of ahead of them. And I think we have several members from Pakistan who are part of COVAX, and also from Aga Khan University, who have contributed to enabling this vaccine rollout. Also, the issue, we have the systems, but our systems were sort of old and they needed upgrading. And I think the COVAX initiative has been very helpful in doing that. We also discussed about the equitable distribution. So, so Pakistan has rolled out its Sinopharm vaccination program, through which frontline healthcare workers will be getting the Sinopharm vaccine. And the healthcare workers here know that there is through the program, the vaccine is going to be received through the National Immunization Management System. So you would SMS your national ID card number to the National Immunization Management System number, and you would get a message which would tell you about, the date of your vaccine and the dose when you are supposed to receive that. However, while this process looks efficient, it is inequitable, and our colleagues discussed this in a bit of detail, how appointments are scheduled on a first come, first serve basis, which makes people without an access to mobile or internet, some of them are even working 2 to 3 jobs a day, might not be able to sign up in time, doses may run out, and also how the allocation of doses is not being done sometimes based on the risk. So for instance, if I'm a frontline healthcare worker taking care of a COVID-19 patient in the ICU, and there is an administrator who is sort of overlooking me, there is a possibility that he or she may be able to get the vaccine before I do. So these were the sort of challenges that we discussed. And also, obviously, whenever there is distribution which involves cell phone and mobile and internet access, also the issues of the vulnerability index, income, gender, and resident location, all of these things become important when we want equitable distribution. Also, based on optimized allocation, service providers can request resources if they are not sufficient. So the good thing about COVAX is that there are challenges, but these can be overcome by discussions and seeking out help. The other challenges that we found were that the urban poor and informal communities also did not have access, especially in systems where there's a lot of we go to private service providers, and we discussed that Pakistan in particular, 85% of the healthcare is sought through private practitioners. So how would the vaccine get to them if the point of vaccination is a government center? So we concluded with some good news and some bad news. So the good news is that most of these vaccines provide 90 to 100% protection against moderate to severe COVID illnesses. And the overall side effect profile of all the vaccines, those which are accepted in Pakistan and those that are in the pipeline, appear to be minimal. Also, the good news is that Pakistan is among the top 15 countries to receive the vaccines through the global COVAX advanced market commitment. And also that the government has committed to provide 500,000 doses to frontline healthcare workers. This is a campaign that is ongoing. And we have more doses that are coming in through COVAX, for example, AstraZeneca. The bad news, is that we have a population of over 220 million. And we know that the herd immunity threshold for vaccination for COVID-19 vaccines is around about 70%, which this is what is, what we think it is. However, we have vaccines, even with COVAX, with our private sector and all the promises that have been made to the government, we will only be able to vaccinate 11% of the population. So it's an uphill road, and there's a lot of work that needs to be done, including, managing the procurement, distribution, administration, and all of those steps which are needed for any effective vaccination program. Because a vaccine is only good when you get it in people's arms, right? So that's the final sort of thing that we need to do. But again, I'm going to conclude with the good news. And the good news is that we have several non-pharmacological methods which have proven to be effective in control. So while we scale up vaccinations, we need to continue wearing our masks. We need to continue hand hygiene and keep our physical distancing measures and be compliant with our COVID SOPs and the policies around controlling COVID. So with this, I will conclude my talk, and thank you so much for listening.
Thank you so much, Dr. Fyezah Jehan, for giving us good news in the end. Our next speaker is coming and giving us a very, very hard thing, which is abstracts and workshop. Dr. Satyan Ahmed, one of our committee members, very quiet and yet in the front line from our committee all the time. Dr. Satyan.
Assalamu alaikum and a very good evening, everyone.
Thank you for this opportunity to present a quick snapshot of the abstracts and workshops that were held during this conference. I would like to begin with the brief introduction of the workshops committee. This subcommittee of the organizing committee was headed by Dr. Syed Hani Abidi. The team members include Dr. Aishal Mas, Dr. Shiraz Hashmi, Dr. Nasreen Rafiq, Ms. Sajda Chagani, Ms. Karunesa Huda, Abdul Khalik, and Mr. Manzoor Yassini. There was a lot of background working involved in making these workshops, especially the first of its kind virtual workshops live. So virtual team meetings were held, strategies were built on, and 7 themes were decided, including clinical management, COVID-19 diagnostics and research, infection control and biosafety, innovations, mental health, preparedness and emergency plan, and quality and patient safety. Eventually, the call for workshops was circulated. The applications received were shortlisted and scrutinized. The registrations were open and they remained open till the 6th of February. Eventually, 21 pre-conference workshops were held over a time span of from 8th of Feb to the 10th of Feb, and still 2 post-conference workshops are yet to follow in the coming week. And you must appreciate that a total of 1,175 participants registered for these virtual workshops. If you look at the cutoffs in the first theme of clinical management, 5 workshops were held, including virtual workshop on COVID-19 and pregnancy, COVID-19 and superinfections, clinical management, dealing with complex cases in ER and CPR in COVID-19. In the second theme, we had the flip style workshop on biomarkers of COVID progression and their validation, NIH grant writing, interpretation of diagnostic texts, and bioinformatic approaches. We had a workshop on infection control and biosafety, followed by innovative workshops on how to conduct virtual team-based learnings, how to make virtual teaching and learning environment effective, online teaching during COVID and challenges and opportunities, and role of nurses in digital health in the COVID era. In the mental health compartment, we had 2 workshops, the no depression workshop and the burnout workshop. And in the quality and patient safety segment, we had a workshop on reflective practices in times of COVID-19. Lastly, in the preparedness and emergency plan, we had 4 workshops on developing and implementing a COVID-19 facility, media communications during the pandemic, new paradigms of parenting and caregiving, and the last one, the impact of COVID-19 pandemic on radiation on practices. As I just mentioned, that 2 post-conference workshops are yet to happen and they're coming in the following week, including NIH grant writing and genomic epidemiology of SARS-CoV-2. Now let's move on towards the abstract committee. This committee was headed by Dr. Fyezah Jehan. The team members included myself, Dr. Masooma Akhil, Dr. Wafa Aftab, Dr. Najiha Iqbal, Dr. Asra Qureshi, Ms. Salima Ratani, Ms. Rozina Roshan, and Mr. Asad Yaqub. Again, virtual team meetings were held of this subcommittee. Strategy was planned. 7 themes were outlined, including epidemiology, diagnostic and testing, infection prevention and vaccinology, public health policy and education, treatment and management, basic biology and immunogenesis, impact and outcomes, and also the other theme. Eventually, the call for abstracts was circulated. Abstracts received were reviewed and scrutinized by, again, small teams of the subcommittee according to the themes. Finally, the participants were notified of their acceptance, and virtual poster and free paper presentations were done on this virtual podium. A total of 317 abstracts were received. 117 were rejected due to various reasons like non-conformity with the themes, incomplete abstracts, and duplicate submissions. And finally, a total of 200 abstracts were accepted for this conference. Out of these 200, 144 abstracts were from within the AQU network. And you can appreciate that most of the abstracts were from Karachi, followed by Lahore, Islamabad, Gilgit, and Peshawar, and 1 each from Sargodha, Sialkot, Multan, Kamoki, and Dinga. And also we had 2 abstracts from Hong Kong and Oman. Thank you.
Thank you so much. There are many, many more people who were serving in our committee. They are not here. They have worked hard behind the screen, and they have worked very, very hard. You have seen some of them as a moderator. They say university are the house of knowledge, and they provide platform to transform, bring all the people together to transform our world and our lives. So as COVID, what COVID brought to our university on this weekend? COVID brought collaboration, organization, vibrant, integration, and devotion. That's COVID of all scientists, practitioner, academician, policymakers, implementers, and researcher together. And those who have attended, I'm sure they must be admiring that what kind of knowledge brought from this house. And inshallah, these kind of knowledgeable, transformational, and very, very informative sessions will be continued through the Aga Khan University. I would like to call our energetic and young medical dean, Dr. Adil Haider, whose sense of humor is also young and energetic. Dr. Adil Haider.
Thank you so much, Professor Rafat. I don't know if I have a joke to start with, but I will start with talking about opportunity. Opportunity to change, opportunity to make a difference. Now, we've heard some incredible scientific presentations over the past 2 days, and what an incredible summary you have all put together. We just heard Faisal talk about the therapeutic changes. We heard Dr. Fyezah Jehan talk about the vaccines. We heard about public health from Dr. Laila, Ladak. We heard about the basic science from Dr. Hani, Abidi. And of course, we also learned that our institution can pull together a conference with hundreds of abstracts in a matter of weeks on one singular topic. It's just incredible. 200 abstracts, just so fantastic. And that explains the opportunity and reminds us of the opportunity we all have. Now, of course, COVID has changed our lives forever. And there is no going back to the way it was. But I think what I've learned most from this conference over the past 2 days is that we have an opportunity to build back better. And we can make a difference. I found 5 things which I am personally planning to do differently. 5 things. And I'm going to share them with you with the hope that they might resonate and you might think of 5 things that you would do differently now that we go forward in COVID. The first is there now are surely better ways to teach and to work. I had the opportunity to talk with a colleague the other day, and they were talking about how they have a new building that's coming up, and they're going to change the way they've built classrooms in this building so that all this hybrid learning, which we're obviously going to be going forward with, can be incorporated. I think we need to see how we're going to do that better. I think about going to work. I have a colleague who I work with. She's fantastic anyway. But during the pandemic, because her kids have to go to school in the morning virtually, she sets them up and so on, does work from home, but then she comes into the office around 11:30 and then goes a little bit early as well. But I got to tell you, I've never seen more productivity out of this individual than I've seen over the past couple of months. It's incredible what she's able to do. So these are different ways of working that we're now learning because of this pandemic. The second thing is to remind my colleagues about refocusing on the importance of human health and science. Never as an area of science will we ever have this much focus on human health, at least in our lifetimes. And those of us who are in this field need to seize that opportunity that comes from COVID and continue to ensure that we make the investments that will lead to a better future. I think that number 3, that we have a great ability to improve access to things that previously folks did not have access to. One great example is this conference. We put on hundreds of hours of learning We had thousands of people join us, and it's all free. It's incredible what we're able to do. So we can use these platforms, and we can use this post-COVID world opportunity to improve access to those who did not have it before. Number 4, and this is a huge thing that we worry about at AKDN, and that is our climate footprint. Doing things virtually has made it possible to decrease the amount of energy we waste. And so we really need to seize that opportunity as well. And finally, in this one, I like, Fyezah, how you talked about personally. This one is a personal one. I think many of us have found an opportunity to reconnect with our families, with our loved ones, and even to take more time. I'm looking at Dr. Rozina here, who's the biggest advocate for this. Take more time for self-care. So those are 5 things that I hope as we move forward, we can do and we can learn from COVID. Now, as we go from this conference, you might say, well, Adil, you always come up with these 3 things or 5 things to do. How are we actually going to do it? And that's where we have saved the best talk for last. We are incredibly grateful that our AKU trustee, Dr. Julie Freischlag, is joining us to give a talk on leading us through this kind of change. Dr. Freischlag is the Dean and the CEO of Wake Forest Health. She's also the Chief Academic Officer of Atrium Health. Along with this, she is the President-elect of the American College of Surgeons, which is the largest organization of surgeons in the world. She's a consummate scientist, 300 plus publications, so it makes sense that she's giving a keynote. She's a member of the very prestigious National Academy of Medicine. But I've seen Dr. Freischlag up front and up close. She first hired me to my first job as a surgeon when she was the chair of surgery at Johns Hopkins. And I saw over a decade how she transformed a very traditional and historical department into one of the most diverse and embracing departments that one could ever see. In fact, that very prestigious department grew in prestige because of the diversity and inclusiveness that Dr. Freischlag brought. That was the first thing I saw her change. The next thing I saw her being able to change was at the American College of Surgeons that now she presides. Many years ago, during Valentine's Day, there was a controversy because some male surgeons had written something inappropriate. Dr. Freischlag took a stand. And at that time, it was not the most popular stand. But now, nearly a decade later, she's the president of that organization of surgeons. That shows you how one person can make a change. So we are extremely grateful to have Dr. Freischlag with us today and look forward to her comments on how change can be made. Dr. Freischlag.
Thank you so much, Dr. Haider. Can you all hear me?
Yes, loud and clear.
Great. Well, I am just delighted to give a talk, and I was able to listen to the last few talks. As you know, it's sort of morning where I'm sitting here today, and I'm just so impressed of how similar the issues you've had to deal with, probably in a much more difficult manner as we've been dealing with COVID-19 in the United States. However, I so agree with you that there's so many things we've learned. I've actually told my people, I have a list of things of what has COVID-19 done for me today. It's not a long list, but it has revolutionized how I think about things and how people work and how people look at what's important to them. So I thought I would just share with you a little bit about what I call leading when everyone is watching. And in parentheses in this talk is when you don't really know what to do, because none of us have had pandemic training. Could you share my slides, please? Thank you so much. I'm at home today, sort of going along with the theme of Dr. Haider. there's an ice storm in my town today, and my connectivity at my house is not always the best. So I appreciate you showing these slides today. So I think you've heard from a lot of your speakers. It challenges our gifts. They force us to search for a new center of gravity. And don't fight them, just find a new way to stand. And I remember specifically as February of 2020, we had a Dean's Forum, and one of my Dean alums came to me and said, what are you going to do about this COVID-19? And I remember saying, COVID-19, I think that's in China. I don't think I'm going to have to deal with COVID-19. And bam, I remember March 18th is when we shut down the operating room. My last visit was up to Yale to see Dr. Ahuja, who actually Dr. Haider knows very well, who's the chair of surgery up there. And here we are almost a year later, looking and learning about a disease that has hurt and killed our colleagues, our friends. Things that have happened have been unbelievable, is how we've had to deal with the virus. And each country, each community, each place has dealt with it differently. And these challenges are ways that we need to go forward and not go back. Next slide. So when we looked at a Gallup poll here in the last March and April, that only half of the people thought that their employer communicated a clear action for COVID-19. And partly is that we didn't know, right? We initially weren't sure you're supposed to wear a mask. I remember we sent all our students home and canceled all surgery. We weren't sure you needed to wear masks in the hospital. And then we figured out you needed to do that, right? We didn't know what you were supposed to do as far as social distancing. We weren't sure whether everybody was going to be susceptible to this disease. And therefore, a lot of confusion. And in the United States, this disease has been politicalized more than anything I've ever seen, from the mask to the vaccines to the behavior to people believing it doesn't even exist still. There was a protest out in Los Angeles just last week at one of the mass vaccination sites of people saying there really isn't COVID-19. And only 36% strongly agree they're confident that they're going to be safe. And you spoke about that today. If I wear my mask and if I do social distance, are you sure I'm going to be safe? And I know as a trustee and head of your health policy committee, it's hard because many of your employees live in areas and dense areas at home where they can't be safe even at home. And we've seen the same thing here, that those families who have many family members in one home or who work at the front line, they are ones that are actually, even though they're trying to be safe, it's very difficult in the way they live. And 78% feel that COVID-19 will have a negative effect or negative on their workplace. And we've seen that with frontline workers, mainly women, women in the entertainment industry, women that are waitresses losing their jobs. The food insecurity in the United States has been incredible to watch. And I know in Pakistan, you've seen that even before COVID-19, but it's been very palpable here. And as you know, we also went through an election during this period of time that has made the divide even deeper in many areas. Next slide. So you do need to fight for the things you care about, and you have to do it in a way that will lead others to join you. And I heard that today. I heard about the things you're learning. I've heard about the things you're teaching each other about social distancing, wearing masks, washing your hands, learning how to continue care outside of COVID. We came back to our institution in June and July and are now teaching, doing research, and doing other operations and other healthcare because people were getting sick because they were scared to come to the hospital. And you have to do it so that others join you. And I think I've seen in an amazing way. I follow Dr. Haider on social media. He follows me a bit too. And having these conferences and giving people information and then hope. We actually make sure that every day you ask one person, how are you today? And ask them truly so that they can tell you the troubles they're having with maintaining their home life balance. Certainly women also have bear the brunt of making sure their children are getting educated. We still have kids at home now a year later and not in the classroom. And that's very difficult as well. So asking everybody every day, how are you today? And using communication in many forms to do that. Next slide. So I think you really talked about that today is what did I learn today? The number of abstracts that were submitted were incredible, looking at all aspects of COVID-19, not only the science, but the social impact, the education impact, and how can I help other people? I'm going to tease you and say Dr. Haider's not that young anymore. I knew him years ago when he was young. He just looks young, which is great, but his energy about how to help other people through this. When he was considering taking this amazing position as dean, we thought it would be very impactful. Little did we know that he would get there to help run the institution through the pandemic and be a leader during that time. And it's been an amazing opportunity for him and for all of you to go forward and do great things. And when you look at your overall impact, what did you do today to help people? And we used to gauge that by our CVs and our science and our operations we performed. Now we're going to do it in ways that he just mentioned. How can we make health for our whole community better? How can we make the world better? They say the air looks great if you're up in space now because we're flying less. We're using less car travel. We're working from home. I was building a new part of my hospital. Now I don't have to build a new parking structure because so many people are working from home. Again, better for the community and better for the environment. Next slide. So this is the Moravian Star. So I'm in an area of North Carolina, which was settled by a lot of German immigrants. And this is their star that tells you to follow your North Star. It sits actually on top of our hospital. If you look behind that star, that's the city of Winston-Salem. We light this star every holiday season to celebrate the holiday season in December. But we lit this star in March during the time where the COVID-19 pandemic began. And this star is as big as you can see. It's huge. We can't even take it off the roof of the hospital because it's so heavy and so big and made by one of our local artists. And when you're moving in the positive, your destination is that bright star. So as you go forward making decisions with what are we going to do with COVID-19, how are we going to take care of our people, following your North Star, staying true to you and your community is so important. Next slide. So you have to do it your own way. Dr. Haider mentioned my time at Johns Hopkins, where I was there 11 years. And I wore red here so you can see me. Because when I was there, I was the only woman chair for 11 years. And many of those people in the picture are very important people. One is Lloyd Minor, who's the dean at Stanford Medical School now. One is John Lewin, who's the executive vice president of Emory University. And one is Brooks Jackson, who's the dean at Iowa. So many of them have gone on to amazing things. But you can see a little lack of diversity in the 2000 at Hopkins. And as Dr. Haider mentioned, what we did is really try to improve diversity. And my job was to speak up, to do it. And sometimes that's uncomfortable. And during the COVID-19 crisis, whoever you are and wherever you are, you need to speak up. You need to say you're not comfortable. You need to say something that perhaps isn't as popular as what other people say, because that's the only way you're going to be able to make change. And you have to be who you are during a pandemic. Next slide. So this is a painting my brother painted. My brother is a watercolor painter. He used to be a special education high school teacher, but he's retired now. And he's spending a few months now down in Phoenix during the Thunderbird art show, where he actually actively paints while other artists are there. And this is COVID-19, isn't it? It's that tiger behind the leaves. It's scary, and you have to follow your fear. I was scared too, understanding what's the best way to stay protected from this disease. How do I keep my family protected? What do I tell people in my community? I had the opportunity to be the first person to sign up for the Moderna trial. So we started the Moderna trial here in August last year. And myself, I signed up number 1, my husband number 2. I got the vaccine and my arm did get bright red and indurated. So I was pretty sure I got the vaccine. And I found out in January that I did get the vaccine, but my husband did not. And so he ended up getting the vaccine this past January. So I tell people everywhere that I've had the vaccine for 5 months, and you can tell everyone too. You have seen someone who's been vaccinated for months, and I look fine. I look like I always have. I had no other effects from it, but I've been protected for 5 months, and that's been very comforting. So following your fear through this disease and relating that to others, being vulnerable is very important. Next slide. So what we did is lots of communication, and I know you've done the same because I've seen some of it. We had a COVID-19 need to know. We have a website where people can go, where they can see what's going on. Especially we had not too many cases in the summer, but then we got hit hard in November, December, and January. The most deadly month in the United States has been January from the disease. And today I just looked at my daily census. We went up to about 200 patients in our whole system. Now we're down to 90. And we've lost 2/3 of our patients to death in the last 3 months, and we're almost up to 300. So it has been a tough time, and it appears to be slowing down a bit. So this was a website where everybody could get information. We could look at research. We sent in many research grants, as you have too. We've had ability to have coping tools. During the day now, we have a pause that comes on your computer screen that says peace. You can have a peaceful thought. If you want to log in, you actually can have a 5-minute meditation that's directed by one of our psychologists, or you can just sit at your desk and take a deep breath. Either one works. Next slide. And we also published about this. My chair of surgery, Wayne Meredith, and my president of the hospital, who's an infectious disease doctor, myself, actually got the opportunity to publish in JAMA about how do you continue to do elective surgeries in this COVID-19 pandemic in the future. And what we've done, which is similar to you, is make sure we do the essential surgeries. We had to decrease the surgeries that had a long ICU stay. So we were making sure we had enough beds for our COVID-19 patients. We used our outpatient procedures and other opportunities to do the procedures. And our patients understood too, they had to be tested, they had to be safe, they had to quarantine in order to have operations. Next slide. And this is the corridor that leads out from our hospital to our employee parking lot. And as you can see, those yellow ribbons represent every patient that has survived COVID-19 and left our hospital. We've had so many now, almost 2,100 that have left the hospitals that we actually have run out of room for the ribbons. So now we just put up numbers so they're still remembered. So as people come back and forth to work, they see the yellow ribbons. So hard work, integrity, I heard that spoken by you today. All the people that have given so much to help take care of those with COVID-19. People have lost their lives taking care of those with COVID-19. People whose lives have been incredibly impacted. They get joy and solitude from walking through and seeing the ribbons. Next slide. So like I said, we ask everybody to ask one person every day or more, how are you doing today? And really mean it. I start that off with all of my meetings with the chairs in my department. How are you? What's going on with you? Especially if you're a leader, people may not be asking you as much. So ask your leaders, how are you today? And are you on a path to achieve your goals this year and your career goals? And we have actually seen a marked increase of research, more innovative teaching, as Dr. Haider said. We've actually had better meetings and attendance, which I've done on virtual platforms. I do miss seeing people, and I can't wait to travel again. And I must admit, I can't do a 2 or 3 day meeting, but I can do a 2 or 3 hour meeting on the web. And then is there anything more I could be doing to help you? And we also have added another question is, have you had your vaccine? And if it's your turn, are you going to get your vaccine? And if not, let me talk to you about getting the vaccine. I, of course, tell about my personal, that I had the vaccine 5 months ago, but also telling people how important it is to get the vaccine, not only for themselves, but for everyone, so we can get back to what we used to do in some ways, travel, getting together in larger groups, and actually making sure that we get our kids back to school. Next slide. So one thing we had started right before the pandemic was a theme. We have a theme every year. Actually, Adil will remember that when I was at Hopkins. And this one was Trust in Action. And Dr. Hai, who is the president of my hospital, as I mentioned, started doing 100 little things to make a big difference. And it sort of got interrupted, but now it's back, where people around the hospital would make suggestions about how we can make it a little better, whether it's a new sign so that you go to the right way instead of the wrong way. We had a couple of those issues, iPads for some children here in the waiting rooms, all different kinds of things to make the experience in the hospital better. And that actually is important. You can do small things around the hospital, celebrate them, give awards. That makes all the difference to people that you're noticing what they're contributing. Next slide. We also formed a racial equity task force over the last year, and I'm sure you've heard about many of the atrocities that were brought to light in the United States against African American men. And during this time of COVID-19, as the racial injustice was reflected, we realized that we needed to do more in our area. My area of North Carolina does have a history of eugenics. We have some very poor areas of town with African American population, difficulty with access. And then we did notice, that COVID-19 has a marked worse effect on those African American as well as Hispanic patients. Our Hispanic patients actually had a much higher death rate than even our African American patients, mainly because of the way they lived at home in large groups, as well as the jobs they had, which were working in chicken plants, frontline, and also fear of coming in to see us because many were undocumented. So we started our racial equity task force that I lead with Goldie Bird. We have a Maya Angelou Center here at Wake Forest School of Medicine. And we actually meet every week where we talk about things that we can do long-term and short-term. We've appointed inclusion chairs in every department and center who are working on work groups in the community for education and looking at ways that we can decrease food scarcity in those communities. And then I bring it to my CEO cabinet, which is about 100 people that have spent time in small groups talking about race, their feelings about race, their education about race, so we can go forward knowing better about us. We presented this work at the AAMC, and we'll continue this equity task force in perpetuity because we feel there's much work to be done immediately, but in the long term. Next slide. So this is me. I'm taking the picture, but this is my OR during the pandemic. As you can see, there is one fella, Adil, my fellow nester. He actually is taking a job in the middle of Tennessee. He's originally from Mexico. But you can see my third-year student, Laura, who is an MD, PhD. She's in the foreground, wants to go into vascular surgery. I have a PA resident in the back. She helped us cut the rib. I'm a thoracic outlet surgeon. A third-year resident, my tech, our nurse anesthetist student. And in the far background is a college student, spends a year with me after finishing college. I get a Wake Forest University student to spend the year with me. And it's been a tough year trying to get her to meetings and get to know people wearing a mask and seeing patients. It is interesting that I've seen so many patients only with masks on, right? And so the only time I've seen their faces when they come to the OR and we take their mask off, and sometimes we're not sure that's the person. One patient had a full beard and I didn't know because he had worn one of those masks all the way up his face. So good teams do make great ones when you trust each other, such as our theme and trust in action. And we have to get rid of me for we. And in the operating room, it's very easy. We do we a lot. But with this pandemic, it's been hard because you really want to be it all about you, but it's got to be all about us as we go forward. And I was impressed with the presentations this morning that you two are all about you and as a team, as a group, as a system in AKU. Next slide. So in summary, I think you're doing all of this. I'm actually inspired this morning because I know the resources are tough. You have 220 million people in your country, many of them in rural areas, many poor. We have over 330 million people. We've gotten about 48 million vaccinated. We're trying very hard to go into underrepresented areas, taking vaccines to patients' homes, trying to make sure everybody gets vaccinated. Now we're going to try to embark on getting our teachers vaccinated so we go back to school. But just like you two, we just don't have enough vaccine, and we're trying very hard to get that done over the next few months. I know you listen to Dr. Fauci too. He's great. He's actually going to talk to us at the American College of Surgeons meetings in October. It's mainly just a sustained effort to make a difference and get us all safe. So how do you do this? You lead from within. Adil had 5 things. I'm going to give you 8 to think about. So you have to own your opportunity. How are you going to make a difference during that pandemic? as far as better care for your patients, yourself, and your family. One of my women faculty made a comment saying it's nice not to have this frenzy. I haven't been on a plane in a year, and I travel a lot. I love going to meetings. I love coming to Karachi and Nairobi as a trustee, but it has made you slow down and think about things in a different way. You have to follow your North Star. I hope you remember that picture of the Moravian Star. We are hoping to get some of the nurses from Nairobi and Karachi to come visit us at Wake Forest Baptist Health, and we'll make sure they see that North Star. But always do the right thing at the right time. Show your true colors. Be that person. Remember me in red. Be who you are every day as you come to help this, because that's the only way you can make a difference. You have to be brave, brave the way, speak out, say what you're thinking, help, have good ideas, and realize that we can't turn back. We are going to change how we educate, how we talk to patients. Yesterday I had clinic and I had 8 patients, 3 in person, 2 new ones, 1 return, 5 telehealth. I had 1 in Montana, 1 in Arizona, 1 in about 200 miles away in North Carolina, and 2 in Florida that I spoke to. The only bad thing is it was really great weather in Florida and Arizona when I spoke to them. Montana, not so much. But I was able to see all those patients without them traveling to see me, all post-ops, and I could see them in their home. You do need to stay connected, whether it's through work, through home, virtual, making sure you talk to each other at all times. Put your trust in action so that you can trust each other, because there is a lot of distrust about the vaccine, about the COVID-19 itself, and we need to dispel all those myths. Build inclusion in whatever you do. We are doing that through our racial task force. We've had time to really develop the racial equity task force. Make sure you always have a very inclusive team, whether it's race or gender or age. I have found that you do need to put lots of young people. Our young people got us through this pandemic, through the hospital and driving our force through our incident command center. And then remember your why. Why are we in this business? Why did this pandemic happen? What lessons is it teaching us? Besides, everyone got affected, as I just heard one of your speakers say. The whole world got affected by the pandemic. And one of my psychiatry chairs, one down in Charlotte, said, the one thing the pandemic's done for him is people now can say, I'm lonely. They can say they're sad and depressed. Before, people didn't say that because they thought they were only one, but the COVID-19 crisis has allowed everyone to say, I'm sad, I'm not doing well today, I feel lonely. And that it's made a conversation about feeling sad and depressed easy for everyone, because it's affected us all in the same way. So thank you very much for asking me to say a few words. I admire all of you for what you do. I know it's been very difficult. I know it's been hard with resources and people. I've been so impressed with how your leaders have led and how you have led. And it's not only top down, but it's bottom up. And your patients and your colleagues will benefit from it. Thank you so much.
Thank you so much, Dr. Julie. It's the best way to do conclusion of this symposium. And today I learned new things, how to look young. So I really learned new things in the COVID. Thank you so much. It was really very good and very reassuring for us that you were with us. And in the end, I would like to call our chair of the committee for 23rd National Symposium, Dr. Syed Asad Ali, to give us note of thanks.
Thank you very much, Dr. Rafat. So, Mr. Rahman, you know, I made fun of him many times, but today I'm gonna start with the famous words of Inzamamul Haq after every, you know, in the press conference after every match, that first of all, thanks to Allah Mia for a very successful and well done conference, and we're very grateful for that. Are my presentation slides up? Vote of thanks. Thank you. So the first thing I would say is that one of the most important things in doing any conference is that you have a team of good people working with you. And this time we really lucked out. We had a fantastic team
the people and the strategy that worked very well that the dean has kind of introduced or really advocated for is the self-nominations and all. We asked for self-nominations for our committee members, and we really got some very dedicated people who were vested. If you have a good team, you really don't have to push them. You don't have to make them work hard. You just have to kind of follow their lead, and we really lucked out in there. So I'm very grateful to all the team members. Thank you for your all your hard work in this. The other thing I think is that we did this without once meeting in person. I think we conducted this workshop. We had about 5 or so meetings, and all of them were online on Zoom. So this is something that really, it was much easier to organize. And I think that was also a very big successful thing. Of course, we had this conference as a virtual conference, which is kind of our first, of this magnitude that we did here. I'm not, there are many advantages of in-person meetings also. So you get to meet people, you get to go away from your normal places, normal work environment. You get to meet old mentors, you get to meet new connections, new collaborations develop and all. So obviously, there are many advantages of that, and we cannot say that the days of in-person meetings are over. However, there were some fantastic and huge advantages of doing it online like we did this time around. This was so much easier, so much less expensive. Otherwise, we would spend so much money in flying people over here, having them stay. The dean mentioned the carbon footprint of all of that. So it was much easier for us organizers in a way. And number two, it was also much easier for people to really benefit from it, to listen to it, because it's much difficult to physically change one room to another, but it's much easier to do it on your phone, on your laptop, or on your computer. You can switch quickly and really take advantage of this. So I think this definitely has a lot of advantages, and it is this technology and all is here to stay. I am particularly grateful to the co-chairs, Dr. Rafat and Dr. Faisal Mahmood. This, as I said, is a self-selected group, and they're both my old-time friends, and just very fortunate that we got to work together on this. The committee members, I want to particularly name some of them. This is our speakers subcommittee. Dr. Faisal Mahmood led it. Dr. Sadaf Altaf, Dr. Laila, Ladak, Dr. Shazia Mashir, Asim Hafiz, Kulsoom Fatma, Shiri Najam, Salma Jafar, Dilshad Begum, and Khwaja Hatim from Conference Secretariat. This was a very rich and diverse group. We kind of challenged each other. The program that you see is a result of a lot of prolonged deliberations. The abstract committee was led by Dr. Fyezah Jehan and Dr. Masooma Akil, Salma Ratani, Septain, Asra, Najiha, Wafa, Rozina, Roshan, and Asad Yaqub were the members, and we really advertised it widely on Facebook, on Twitter, through emails, through personal letters to all the big name institutions of Pakistan, and that's why we got this overwhelming response of people in terms of their abstracts. For workshops, it was led by Hani. We had Drs. Aisha Almas, Shiraz Hashmi, Khairunisa Huda, Nasreen, and Sajda and Manzoor that were the members of this. And I think 21 workshops is probably kind of a record what we had in here. And I think that was also very successful. This is a slide I really want to spend some time on. This was my first time actually chairing organize a conference of this size. And I think it couldn't have been possible without the very, very strong conference secretariat support that we have in here. It really, I think we are fortunate to have them. I have listed some: Manzoor, Asad, Irshad, Rasool from Office of Communications. I was here late last evening, and Rasool was here trying to finish off these press releases. Ahmed Mansoor from Resource Development. I'll also say that, this because of this being virtual, we were able to do it with a fraction of a cost that we normally do. So all those pressures of engaging sponsors and all were significantly, from pharmaceuticals and all, were significantly reduced. We didn't have to pay for the meals and all. And then from communications, Sheroz and Janelle has been excellent always. Rahman from finance. Ajmal from audiovisual is fantastic. Abdul Khalik has been really a great support from the AV. Thank you for that. Sulaiman Hudani from purchase. Khadija Dosa and Zahira are the student volunteers. Michael and Shakir from our research facilitation office. I am very grateful to our keynote speakers. We really lucked out. We had fantastic keynote speakers. As the Dean said, it's Aga Khan University who can really pull this diverse set of speakers together in one forum. Dr. Faisal Sultan was here, who's the Special Assistant to Prime Minister. We had really the world leader in terms of COVID response, Dr. Maria Van Kerkhove. She was there and she's there on television all the time. We are just so fantastic to have her here. And today, what a fantastic keynote address we had from Dr. Freischlag, really inspiring. And I think I am personally very motivated and learned a lot. Our chief guest, the Honorable Chief Minister, Murad Ali Shah, and then of course our president, who has also joined us now for this session as well, and our deans, whose leadership is always very inspiring to all of us. I also want to acknowledge the portal folks. The portal that we used was BRN, and I think I've heard fantastic feedback on them from everybody. So that is great. I want to particularly thank all our speakers. I think the speakers, we had a long list of speakers in here, and it takes a lot of effort to prepare those fantastic talk. And I was just in one of those chats, and a comment I heard was that the speakers here, and this was an ID consultant talking, and he said the speakers here were better than the speakers of ID Week, which is really, a premier institution and premier organization of the US. So we really had fantastic ones, and the good thing is that many of them were indigenous and our own. So I think we made, so very grateful to them. I'm also very thankful to all the to the people who submitted their abstracts, and those who were selected for oral presentations. I think this conference, after all, has a lot to do for young people who are making contacts through these conferences, and I really hope that this goes forward for them. So I hope that, and finally, all the participants we had, everybody, all organizers are a little nervous about the participation, but I'm very, very happy with the kind of attendance we got yesterday. At one time in all our sessions, in each one of them, we had close to 200 participants in there, which I think is much more than what we would have had if we were doing it live. So thank you to all the participants who attended this and all. So very grateful to everybody. I have made a lot of new friends in organizing this, and I hope you all have too. And my sincere thanks to all of you. And I look forward to, again, our 24th NHSRS next year. Thank you very much.
Thank you. And we conclude here our Aga Khan University 23rd National Health Research Symposium. Thank you so much.